As a local GP, you have had to break the news to one of your longtime patients that she has breast cancer. During the consult, she becomes highly emotional and begins to cry uncontrollably. How do you respond?
Hi, I'm Tom.
Pleasure. So, I presume that you have had a chance to read the prompt?
Yeah, that's right.
So how would you respond?
Yeah, okay. So just so make sure I understand correctly, so I'm a local GP and I've broken the news to someone that they have breast cancer and I've gotten quite upset and started crying.
Exactly.
Okay. So I want to address the situation sort of thinking about it as a timeline of like the way that I would do this in a really kind of emotionally competent way, I guess, as a GP. So there are different steps along the way. So first off, I would have hoped that when I brought this person in for the consultation, even before actually introducing myself on that day, I would have made it clear that it was like a serious matter that they need to be brought in for. So whether it was I think a phone call from my receptionist or whether I made the call saying that we need to discuss the results of your test. I know you can't disclose the results over the phone, but you have to be very serious in your tone. And then in the way that I introduce myself, so hi, such and such, thank you for coming in today. You want to be you don't need to be like dramatic, but you want to make sure that you're being serious and very clinical at that stage. You want to be very friendly and kind of laughing and joking. Then in the way that I set up the room, I want to make sure I have tissues on hand. I want to make sure that the room's set up in a way, kind of like not like this, so that I can be more empathetic and don't have any like walls or computers or things that are set up to block my interaction with the other person, so I can have a nice open body language. There are different schools of thought about how you actually break bad news, whether you do kind of like you pad it with like nice information, you work up to it, or if you just sort of like hit them with bad news. I'm not sure from an evidence spacing what is best, but I would tend towards giving the information more quickly because they know why they're there, they've had the test, they appreciate that this is a serious matter. So that's why you've come in today to discuss the results of your recent breast biopsy. I'm sorry to say that it's shown that you do have an early cancer or whatever those particular results are. And then at that time, I think the way that you should be expecting like some sort of emotional response. Like the typical stages of grieving, like denial, like anger, depression, like those kind of things are expected responses for anyone who gets any surprising or bad news. So I would just basically be there, listening, acknowledging, saying like it's normal to cry and be upset, take as much time as you need and just sit there. I wouldn't actively try and fix, I wouldn't try and say anything. It's better to be quiet and listen. And it's not so much of being transactional, being like, oh, just wait till it passes. It's just more about just sitting there and being in that moment. That's your job as a doctor, to feel that emotion and bear that burden for the patient. And the more you try and say things and fix it, the worse it'll be. You can offer tissues, you can do nice gestures, you can put your hand on their shoulder and say, look, I'm sorry, I know this is really, really tough news. Also kind of depends on how well I know the patient as well, whether it's been a long time or if this is the first visit I've ever had with this person. And then appreciate that maybe some of the more medical advice, they may not be in a state to really appreciate some of that information. So I'd also probably make another time for them to come back and chat with them again about it, maybe with a family member as well, so they can have extra support there as well, depending on the situation. But ultimately, like there's no blueprint of how to deal with this situation. You just be like a kind, nice person, listen, be quiet, and that's it.
Okay, fantastic. And that is actually the only question that we have in this station.
Okay.
Do you feel as if there's anything more you'd like to add?
I don't think so. I think I've said everything I want to say.
Okay, so you have the option to sit here for the rest of the time, or you can feel free to go back and wait in the corridor.
Sure. I think I'll wait in here, just in case I think of anything else.
Thank you kindly.
That's all right.